Hi, this video is the art of hair transplant restoration surgery on restoring the hairline. This client had he had a head injury in the past, and there's indentation of the skull right here, and then they had a line of scar in the front. So with that, it's the good thing is his scar on the front is hard to see, and so you can put the hair out and hide it. However, after the surgery, the hairline recede up, and it happened quite often. It's not just you have numbness along the linear scar, but when they cut the blood supply, you start losing the hair down there. So his hairline is rising up a little bit more. And then on the side, you can see there's a line of scar right here, and on this side there's a line of scar right here. So my goal is to not only recreate the hairline, but fill in the scar as well. And this type of technique is very effective. Hair transplant, again, and I focus heavily on the artistry of the hairline. It's not just the surgical skill of the surgeon, it's the artistic and aesthetic detail to ensure a very natural result. So on average, from the mid-eyebrow to the hairline, for Asian and Black it's around 6.5 to 7. For Caucasians, around 7.5 to 8.5 centimeter. Hispanic can vary from 6 down as low as 6.5, can be as high as 8.5. And although we use average ethnic hairline as a guide, but when we build the hairline, we build it according to each individual facial structure. From the mid-eyebrow to the hairline as proportionally as a third. From the mid-glabella to the tip of the nose as a third, and the tip of the nose and bottom chin as a third, as long as the overall proportional. Once we get the height down, and we have to arch back up, the more narrow the face, the higher the arch. The more round the face, the more flat the arch. Now, this client he not only have receding hairline, but the temple has gone back. So if I just lower the hairline, go straight across, he has some hair, but it's slightly off wide. The forehead is a little bit wide. So while we at it, why not bring in the temple as well? Temple, for example, here it is very important because it really narrow the forehead and bring symmetry to the face. Otherwise, if the forehead too wide, you have a V pattern. So for, again, Caucasian most acute backward, for Asian it's less, for Black it's perpendicular like this one, but this one is still a little bit tilted back. Now, from the midpoint to the side, average is around 7 to 9 centimeter. From the midpoint to the side, average around 7 to 9 centimeter. And for this client, because it's a pretty big guy, his head is a little bit big too, so his there's a lot of brain in there. So that's average around almost 9 centimeter. And when you measure on both sides, make sure it's even. Okay? And so that's where it is. Once we get the shape down, we will transplant a very precise angle at 35-45 in the front, increase when you go backward, and changes when you go different direction. On the temple, it's really flat against the skin and pointed backward. Selection of hair grafts is important, not just the precise angle. We transplant rows and rows of single hair graft in the front, followed by root with 2 hair, 3 hair, and 4 hair in the back for bulk and volume. The temple is mostly root that goes single hair. On a rare occasion, behind, far back, and maybe root with 2 hair. But majority of the time, root that goes single hair. I'm excited for this client because he looks different next year. As I mentioned, just joking with him, I may give him a Enrique Iglesias look. So we'll see. Thank you.